am really excited for this next session, and I'm going to tell you something super, super personal. I asked Iowa Women's Health Center to be here. I begged. They didn't take them very much to say no. But if any of you have known me for a long time, you probably notice I look a little different than I did last year. I was going through a hormonal fucking crisis. It's really neat to be in your 40s. Those of you that have already done it are laughing like, yeah, it's neat, huh? Uh-huh. When I was in my 30s, I was like, these guys are just whiny, lazy, angry women, and they should stop that. And then I got into my 40s, and I thought, wow, life is really hard like this. So I started going to Iowa Women's Health Center a year and a half ago, and I go there all the time. I disrupt their whole day when I show up, and I'm not sorry. But it has helped me so incredibly much. In the last, 6 or 8 months, I've lost 50 pounds. I'm off my ADHD medication, which is really big because I couldn't stand to be that fucking wired anymore. I loved it when I was younger, but getting older, it wasn't working. I've been able to reduce my antidepressants, which I'm not saying that that's necessarily something for everybody, but with the guidance of my doctor, I've been able to come down on those, which has just helped me actually have feelings. Weird. I'm not sure if I like that, but it's fine. And I have gotten, and it's not just like the testosterone hormones and the progesterone and the estrogen that we hear about. I've also been able to get other hormones like my thyroid, which my regular doctor told me for years was fine. It was normal. I was fine. And it turns out I was normal, weird, but also we could make things better. So I can't say enough about this clinic. Dr. Rexroth is my doctor, but he was not invited. It's the whole penis thing. Didn't work out. So I'm so glad that he had staff to come, and I just can't wait for you guys to take this information in and do with it what you will. So without further ado, Jessica, welcome.
All right, so I first want to start off. I'm Jessica Jacobson. I'm a nurse practitioner with Iowa Women's Health Center. I am not a public speaker. They did have to beg us to come here today. That was very true. We like to meet with patients in one-to-one, ratios in our office. I think I spend a lot of time with patients there. I do see the benefit of getting the word out about more hormones, perimenopause, menopause. It's very common that we see patients and they see primary care providers, they see gynecologists, and they're told everything is normal. You're fine. This is just the aging process, right? And so I think that's where our clinic really sets ourselves apart from other clinics, is that we are going to sit down, we're going to have a conversation, we're going to justify your feelings, we're going to tell you, normal. Yes, but can we do better? Probably so. Okay, so just bear with me with the public speaking. And then I followed Sophia, and oh my gosh, what a presentation. So first and foremost, a little bit about myself. I am from Cedar Rapids. I grew up in Fairfax. I went to Prairie High School, and then ended up working in the emergency department as an ER nurse for several years before my husband said, why are you acting like a provider and not being paid like a provider, right? So I went back to school. I have twin boys who are 14 years old next week. I can't believe it. And then I went down the nurse practitioner role. So with that, I never thought I would do women's health, to be honest with you. Never had any desire or dream. Actually, I wanted to work in the hospital setting and do really sick acute patients. And so my degree is adult gerontology acute care nurse practitioner, but allows me to see anyone from the age of 13 to 100 plus, and I've seen every age in that span. And so I did internal medicine. That was the first thing I did, and gosh, I learned so much. I took care of very complex patients, but I did have my fair share of women coming in, and not only did I do their complex health situations, diabetes, high blood pressure, kidneys, I also did their women's health, and I felt like, wow, it was rewarding. Did I have enough time to spend with them? Probably not. And the beauty of it at my clinic at that point, I was down in Coralville, was that we had an OB/GYN clinic inside of our building. So if they needed more attention, if they needed to have further discussion about women's health, I would just refer them over. And so I finally got a phone call from the OB/GYN clinic, and they said, we want you to come over. We want you to take care of just women. You do a phenomenal job of what you do. Would you consider? And I really did have to consider, because as much as I love taking care of females, I also like males too. I mean, I like to see both sexes and work with them in every challenge in their life. So I finally went over to Women's Health, and gosh, I'm so happy I did. I connect with women, I think, at a very personal level, and I think that's the most important thing. I hear stories after stories of like, my provider gave me 5 minutes to talk about 10 problems, and that's really sad to me. That's not what healthcare should be, and not how I'd want to treat my patients or have a provider treat me. So I went over to Women's Health there. I did that for about 2 years, and here's the fun part. This is where the hormones come in, and menopause and perimenopause, okay? So I'd have women sitting in front of me, and I'd say 40s to 60s, and maybe later 30s too, and they'd commonly say, I have low sex drive, I'm gaining weight in my midsection, I'm tired all of the time, and every lab result is normal, I'm having hot flashes, I'm having night sweats. And I'd sit there, because it was a very traditional based healthcare facility that I worked in, and I'd be like, well, you need to hold hands more often, you need to go on date nights. And women would look at me crazy, just like you're kind of looking right now. I'd say you need to work out more, you need to go in a calorie restriction, all of those things that women just were like, okay, yeah, that'll work, right? And so I didn't really have options, and that really was bothersome. It was very bothersome as a provider not to have a tool for them to utilize. So when I started looking for a different facility to work in, to be a little closer to home and with my children more often, I found Iowa Women's Health Center. And I'll be honest with you, the pellets did kind of scare me, and that's really what we're going to focus on here today. It's called bioidentical hormone replacement via BioT. And a lot of the times the problem that I had with it when I'd see patients who would see other providers outside of our clinic is they didn't know what was inside of their body. And I am a person that firmly believes you should absolutely know what's in your body at all times. And they'd have bleeding, or they'd have something going on, and I had no idea what was in their system. So I talked to Dr. Rexroth, and he was like, come shadow, come hear about it, hear from these women who are using the bioidentical hormone replacement. And no pressure. If you don't want to do anything with this, that's fine, but you should absolutely come here. So I came, and I'm telling you what, every woman told me, oh my gosh, this changed my life. I feel like I'm in my 20s and 30s again. I feel like, oh my gosh, our relationship, I'm not going to lose my marriage. And how do you ignore those kind of things, right? So at that point, I decided I was going to take a line with this office, and I'm really happy I did. But I like to tell women too, it's not the only option. There's several different options for hormone replacement therapy, but really at our office, we focus on bioidentical, which bioidentical, if you're not familiar with that term, it's mimicking what your body makes itself or isn't making that we replace. Does that make sense to everyone? Yes? Am I going too fast or following along? Okay, so I'm going to start going into this. I would like to give a little overview about our office, because we do other things other than just pellets and weight loss shots. That's a common thing we see patients for, but they're like, oh my gosh, you do annual women health exams, you do abnormal bleeding, other like urinary incontinence is a really popular one too. So we are located off of Glass Road in Edgewood. We recently celebrated our 2-year anniversary. As you can see, Dr. Rexroth and Sashi Solomon is my colleague, another nurse practitioner, and we specialize really women's annual health exams, abnormal uterine bleeding, endometriosis, bioidentical hormone replacement, weight loss, urinary disorders, endometriosis, fibroids, fertility, you name it, anything women's health, UTIs, abdominal pains. We're happy to see women of all sorts. So, and then we do have an on-site lab, which is beautiful because we like to get results back quickly. and it's a nice process. We have urodynamic testing, anal manometry, and that's more for like rectal incontinence and such like that. And it is a thing. Honestly, I never used to talk to my patients. I never asked them, do you have orgasms and do you leak stool? Okay. I came to this clinic and I just didn't think women would tell me, to be quite frank, right? And now I ask them and they do tell me, and I'm like, oh my gosh, you do? Why would you live like that? I can help you. Like, there's things to do, okay? And then the other side piece that's kind of unique to our clinic is that we do see men as well. Dr. Rexroth is very much so wanting to involve both men and women, especially for testosterone replacement therapy. And I'll tell you what, a lot of men do come to our office after their wives have been into the clinic or their significant others. And most of the time it's like, my wife feels so good, looks so good, I want to keep up with her. I want to do the things too. So it's kind of a nice lead in. And then also I think people just like the fact that we are healthcare providers, and as much as you have to run a business, we're not here to make money off of you. We're not trying to like be a used car sales service. We want you to feel better. And it's very evident. We do a lot of female health assessment sheets, male health assessment sheets, where you're marking all of your symptoms. And at the end of the day, and every time you come in, we're always asking, what are those symptoms like? Are they getting better? Because what's the purpose? If you're coming into me and things aren't getting better, why are we doing this? And I'm very frank with my patients about that, because why, right? So that's a little bit about our clinic. Is there any questions about our clinic at all? No? Okay. So jumping into perimenopause and menopause, and before I do that, I do want to take this jacket off, and I'll tell you why, okay? I am in the medical profession, but women tell me more things when I have that jacket off, and truly I am a woman. So this is woman to woman. This is a very safe place today. If there are questions about anything, menopause, perimenopause, and women's health in general, I'm very open to that today, okay? So perimenopause and menopause, over 2 million women enter into menopause in the United States, 6,000 women a day. I mean, that is a large amount. Symptoms can start up to 15 years before. It's very common that I see 40-year-old, 41, 42, 43-year-olds coming in with hot flashes, night sweats, sleep issues, fatigue, and what I tell women, because we usually start with blood work right off the bat to kind of just identify what's going on, is if you're not in menopause, it doesn't mean you can't have all of the symptoms of menopause. And that's a huge, huge thing. And I also feel like when women can come into the office and just tell someone all of their issues and not feel judged and not feel like, oh, this is aging, you're just crazy. That's just another, like, we're women, right? Let's talk about this. Let's figure out, how do we make your quality of life better? And then most women are affected in more ways than they realize. I have a lot of, I would say, people who are in perimenopause going into menopause who blame their joint pains on just, I'm lifting more than I usually do, or this is aging, I'm supposed to have arthritis. That's not really true. And most of the time, if we give them a little bit of estrogen or even a little bit of testosterone, those symptoms do get better. And then they start realizing, wow, this is just my transition. And even though it can be scary and uncomfortable, having those conversations are the starting point with that, okay? And then going to the next, again, all of these symptoms. So extreme fatigue, mood swings, anxiety, tension, irritability, lack of sleep. Are any of you waking up at 3 a.m. and not able to fall back asleep? I mean, that's very common. Memory loss, feelings of depression, lack of focus, brain fog, hot flashes. Brain fog is a big one. And here's the thing. A lot of us, as we age, we are evolving as women, and we're very successful in our careers. And we have to be on the spot with our answers. I have VPs of big corporations, CEOs. They're like, I have to be able to answer these questions now. And when you go into that brain fog process, it's like, what day is it? Where am I at? And how was I going to answer that question? It's very, very real. And when we do pursue bioidentical bioidentical hormone replacement, I do hear from these individuals that those symptoms improve. And so that's just phenomenal in itself. And we have a lot on our shoulders as women, as professional women, as mothers, as all of the things. So I think that's really important. I also want to tell you kind of a story. There's a couple of women that stick out, and I don't want to forget about these. So even though this is really specific to 40 through 60-year-olds, recently we had a 33-year-old female come in, and unfortunately she was diagnosed with triple negative breast cancer, okay? And so she came to our office. She found our office because she was just miserable from all the treatments that she was getting. It's quite intense. And to the fact that her husband was carrying her from her bed to the dinner table or to the living room, and she was such an independent woman, 33 years old. Can you imagine? You know, you just can't even move around like you used to or be with your kids. And so she wanted to pursue testosterone, which with triple negative breast cancer, there's a certain thing that we use with the testosterone to make sure that there would be no hormones. But here's where I'm going with this story. She pelleted, she did the testosterone replacement, and she came back 3-4 months later, and she was walking. I mean, she came in a wheelchair initially, and she was walking, and she was like, oh my gosh, this has changed my life, right? Like, I mean, how do you not acknowledge that? I sat and cried with her. I was just astounded myself that this had affected this lady so much and got her to get up with her kids with such a terrible diagnosis, right? So that's one. The other one I wanted to make sure I shared with you guys, she's in her 60s. She has chronic conditions, chronic conditions, and she actually heard about us from one of her friends who felt so good with using the bioidentical replacement. And she walked in with a walker. I'm not kidding. Walked in with a walker, looked like she was 90 years old, in her 60s. And wanted to pursue this. And 3 months later came back, no walker, was dancing to the room. I'm not kidding you. And it's just like, wow, if we can have this effect on women and women who are very sick too, I mean, just imagine what this can change in your life. So hormones, most of you know, estrogen, testosterone, progesterone, all of these hormones come from the ovaries, and they deplete over time. So the average age for menopause is 51, give or take 5 years before, 5 years after. Now, like I said, you can have symptoms 10, 15 years even before that process, but typically that's what we see in the United States is around the age of 51. And what happens with that is our ovaries start to deplete of the estrogen, okay? And that's the hot flashes, the night sweats. Testosterone is a little different. So I kind of want to jump into that. So a lot of women don't know that they can have testosterone. And it is very specific to just pellets. There is a couple of other options, and I always present that to all of my patients. But testosterone is present in both men and women. Obviously, men have much more testosterone than we do. And as women, we make a small amount, and usually that drops off in our 20s and 30s, okay? And so it's not uncommon to see a 40-year-old woman, 50-year-old woman have lower testosterone levels. Now, a lot of the times when I look at the labs with patients, they'll be like, well, I'm in normal range, so why would I need testosterone? And what I tell them is normal range with our lab system just takes 100, let's say it's 0 to 100 is normal reference range. They take 100 women and they say on a Bell's curve, this is normal, okay? When we replace testosterone, our goal is to optimize, okay? So we put the testosterone in and we're looking for 150 to 250. So if someone's not even making testosterone or on the lower end, they feel significantly better when we get them to those levels, and that's what the literature supports, and that's where women honestly feel very good and their quality of life, just like Kendra said, I mean, energy-wise, mood-wise, I could go on for days. Sleep too.
I go to sleep. It's so weird.
Yes.
Like a person.
I'm glad to hear that. Sleep is it's huge.
That was the first thing I noticed.
You don't realize it until you actually feel it. Yes, sex drive. Sorry, sex drive's a huge one too, gals. I'm telling you what, that's the other thing. They bring their husbands in and are like, I need to keep up with them, and so that is always something. That's one of the ones that I just feels like goes with it, but all the other benefits too. The other things I like to talk about, it's not just the acute symptoms that you're having, like not sleeping, hot flashes, night sweats. There's a lot of preventative benefit from using testosterone just by itself, and with that, bones. So I don't know if you know, but not many men have osteoporosis, okay, and it's because they carry testosterone for much longer and a higher amount, so it's very protective. I have seen studies where women go off of their Prolia, they go off of their Fosamax, they go off of being concerned about osteopenia, which is thinning of the bones, and osteoporosis, because of just testosterone replacement. Brain. So every one of us probably knows someone with dementia or Alzheimer's, and that is something that is correlated with the loss of hormones, especially estrogen, but testosterone too. It decreases the B amyloids that can lead to dementia and Alzheimer's. So that's a scary thing, right? We don't want to lose our minds. We want to be there mentally for a long, long time. And then breasts. So there are studies that support that testosterone can be breast protective. There was a study done by Dr. Glasser where there was a breast mass and they put testosterone pellets around the breast mass and it shrunk in size and resolved. So huge information on that, and I hope there's more studies to support that. And then cardiovascular. So there's no doubt that when women go through menopause, that is the highest time period for a heart attack or stroke to occur for us as women, okay? And it's that depletion of estrogen, okay, that was really lining our carotid arteries and our heart coronary arteries and making it so our cholesterol levels didn't go up. I have seen commonly where women go through menopause, they drop off their estrogen, and then the next thing you know, you get that midsection fat, and you also have cholesterols that go through the roof. And then they're on a statin, they're on high blood pressure medication, and it's just this, snowball effect, right? And that doesn't have to happen. And the biggest thing I'd like to say is that pursuing hormone replacement therapy close to menopause is the most important thing that you can do for long-term longevity and such like that. And not to say that we wouldn't offer it to someone who's 5-10 years out from menopause, because there's benefits with that. But the closer you are to menopause, the more positively these hormones will affect you for long-term. Okay, is there questions so far? It's just a lot of information.
I have to share something. Dr. Rexroth told me that stat that you have up there that women 20 to 40 lose 50% of their testosterone a year. He made the comment to me one time, and I tell everybody, he's like, if men lost their hormones at the rate that women lose them, it's like this would already be fixed.
Yes.
Men would have fixed it.
Yes.
And we just didn't take it.
Mm-hmm.
And he's just like, I don't know, I just thought that was a really profound thing, especially coming from a man. I mean, it was profound that was like,
yes, and commonly in my conversations with patients, they're like, well, can I get testosterone as an injection or gels? And the FDA does not approve of that. They don't approve of that because they have to have so much evidence that supports that women would benefit from that, and no one really wants to give the time or day for that. So testosterone, and here's the other thing, there was a very, very bad study performed in 2002. It was called the Women's Health Initiative, and what it did is it came out and said hormones were bad, and providers, healthcare providers, women all got very scared. I think I just read a stat the other day that after that Women's Health Initiative, less than 80% of women were able to receive hormone replacement therapy. I mean, that's only saying that 20% of women across the United States are being offered that, which is just wild, okay? So it came out and it said, but truly what the problem was, it wasn't so much the estrogen that they were prescribing, it was the progesterone, okay? And more the synthetic, okay? So synthetic, that means it comes from horse urine compared to the bioidentical, like I said, that is made very naturally out of soy, yams, beets, and really mimics what our body was producing or is producing currently. So that's the big difference between hormone replacement therapy synthetic, think of like Prempro. Prempro was a big one back in the day. And now bioidentical, we think of more like estradiol patches, estradiol creams, estradiol vaginal rings, and then the estradiol pellets. Okay, does that make sense to you all? Okay. And then going on, I've talked about a lot of the positive effects of the bioidentical hormone replacement. Estrogen, we talked about this as well. So it's present in both men and women, large amounts in women, very small in men, has over 400 functions on the body. That's huge. And so when we do go through that transition, you're losing all of that. And that's hence why we can feel so crappy. And then maintains bone density. This is a huge one as well. In addition to the testosterone, estrogen can be huge with bone supplementation. Maintains collagen in your skin. Almost every female health assessment that I see, dry skin is something that's marked, or wrinkles and such like that. And that's where we lose that estrogen, and it takes a huge effect on our skin as well. And it increases serotonin and dopamine, the happy hormones. So testosterone, I think, can do just as good a job as estrogen, but really moods can be totally affected by the whole transition. Positive, so hot flashes, maintain skin. We kind of went over this. I'm going to skip to the next one because I think this is where the juice is at. So hormone therapy. So like I said, synthetic, there's pills, patches, shots, bioidentical, pills, patches, creams, gels, pellets, and rings, okay? And delivery is a huge thing, and this is another conversation for safety profile that I have with patients because of that concern with estrogen use. Really, most of our practice does not prescribe oral estrogen to women because it does go through the first pass. So it goes through your liver and kidneys, and it can have a higher risk for blood clots to develop. So really, we concentrate on transdermal, which are your estradiol patches. Sometimes what I hear with those is I have to remember to change these twice a week, or I don't like how they look, or they fall off, or skin irritation's another one. The creams, again, some sensitivity with that, but really we're open to have any discussion because it's so individualized. That's the other thing with hormone replacement therapy. Is that every woman is different. Not every woman has the same symptoms. I tell women there's women that have no symptoms at all, and I don't see those patients because they're not at our clinic unless they're for annual exams and such. And then there's women who have mild symptoms, and they're like, I still feel good. I don't think I need anything, and that's fair. And then there's the moderate to severe and very severe. And honestly, sometimes I have to push those very severe people to trust the process and know that they will feel better. And whether it's we're doing the patches, we're doing the rings, we're doing the pellets, whichever, it's just a discussion to be had with your healthcare provider. So going to the next, the bioidentical hormone pellets. So does anyone know what these pellets look like? Yes. Okay. So I like to describe them as Tic Tacs, kind of, or mechanical pencil erasers. The erasers a little maybe shorter, maybe a little thicker, depending on what we have to use, okay? They're made out of soy yams, like I told you before, and they're dose specific. So we're not just putting just a random pellet in without knowing the dose or anything along those lines. And how the procedure works, because I have heard many different ways people are describing these pellets. They are not anal beads, first and foremost, okay? And we don't put them into the anus, okay? This truly is a small incision on the subcutaneous area of your buttock, okay? So think about...
It's right here.
Yeah.
Do you want to see my scar?
They're 3 finger breaths from the butt crack area. There's no medical crease, maybe, term. And so we do numb up that area. We make a small incision, and then I take a device and I put those pellets underneath the skin. For women, it's usually between 1 to 4 pellets at max, depending if we're using both testosterone and estrogen. And then I take out my device and I put a steri strip over there. That's all I need for that small incision. And then a 2x2 and a Tegaderm dressing. So there's a pressure dressing on it. We have women keep those on for 3 to 4 days. And you can be a little achy for a couple days after once that lidocaine wears off. Mostly women tell me when they sit down, they're like, oh, I forgot that was there. But the beauty beauty of these pellets, okay, is that we put them underneath the skin and they disintegrate over a slow amount of time. So women get about 3 to 4 months of coverage with this pellet or these pellets. And how I explain it to women, how they disintegrate under the skin is by cardiac output. So the more that you're moving, the quicker that these pellets are going to dissolve underneath the skin. So I give an example. I have marathon runners, we have police officers, firefighters, high stress jobs. They tend to burn through these a little bit quicker because that constant chaos or constant hard training just makes it dissolve quicker. My more like average, I work out 3 to 4 times a week, those kind of things, I'd say they get about 3.5 months of coverage. And then my sedentary, which just doesn't usually last long because typically you make those lines connect and they're moving, their energy feels better, they're sleeping better, and everything, looks great. So they're about 4 months if they're sedentary, but that typically changes. And how we kind of figure that out, I'll have patients come in for their next round of pelleting, and they'll say, about a week ago, I felt like that brain fog was kind of coming back, or I was more tired. I saw some of the symptoms come back. And usually what I'm telling them is, hey, we would probably recommend that you come in a week earlier next time, just because we don't want you to run out. And that's the beauty of it, is that you should have that 3 to 4 months of coverage. And then the next thing is if you feel like you're not where you are, we can always check labs. We're very open to that. And we think it's important just because this is an investment. And that's where I kind of go down the route of it's not covered by insurance. The FDA will never cover this. I always tell patients it is an investment. And truly anymore, and with
Testing is, right?
the testing is, yeah. So when you come in for your consult with myself, Sashi, or Dr. Rexroth, that is covered. Your insurance will allow a hormone consult, okay? The blood work we can send through insurance. I typically tell my patients or advise my patients that it is cheaper through our lab on site. And so it's a $2,200 panel because, like Kendra said, we're not just checking your sex hormones. We think those are important, but we want to make sure there's not a physiological cause of some of your symptoms that can be missed, especially if you haven't had testing before. But we check vitamin D, we check vitamin B12, we check thyroid in detail. I'm looking to make sure you don't have Hashimoto's, which is a common cause of hypothyroidism that just needs education in itself. Most people just don't even know what that is or how they can help with their symptoms in that regard. And then really looking at more detail, so a TSH, a free T3, a free T4, and just, even if they are normal, we have discussion about what we'd like to see. And then what happens is, so it's $50 through our clinic to do that. And most patients are like, I don't even want to mess with insurance. And if you've ever gotten a lab bill after the fact, we can never really retort that backwards. So they usually go down that route. I have the labs. I send a book. So this is a book, and we have plenty of them today, and I'd like you all to take one, okay? The title itself, it's a good chuckle. Great sex never ends, right? But really it's the hormone and health, and it talks a lot about perimenopause and menopause. And truly, my patients take this and they come back and they're like, oh my gosh, like these scenarios in here, they're talking about me. This gal wrote about me, truly. And that's where I think like normalizing some of it is important, so that you're not the only woman that's going through these symptoms or these changes. And then we kind of build off of this. I go over all of the lab work with you right in person. I think that's a huge thing. I think a lot of women get a phone call from their provider and they're like, everything's fine, have a good day. Like how often does that happen, right? So we sit down and we go through everything, and then we talk about all the options and treatment plans, and it's never a one size fits all, I will tell you that. And every woman has their own way they would like to go about this transition in their life, and I'm very open to that. I tell people, you drive the bus, girl. I'm just here with the tools, and what tools can we offer to you, okay? So please take one of these books with you. Please read through it. If you feel like, oh my gosh, I want to talk more about this, you definitely should be coming to our clinic, okay? And I always tell patients too, there is no pressure with these pellets. I think people get so like, oh my gosh, I have to pay the money, I have to do it all out of pocket. That's not the truth. There's many other options that we can do. So the pellets aren't just the only thing, but oh my gosh, I'm telling you, coming from a different traditional clinic to this, women's lives are changing. It's hard for me to even quantify or qualify to tell women about this. So please get one of these. So I had a video, but I also wanted to read this to you guys. And this is what we'll end on. So, wait 1 second. So Brandy, age 49. When I tell people about my journey to hormone replacement therapy, I say, it's like driving the junkiest car you've ever owned. Every check engine light is on, and when you get up in the morning to start, it's like, rah, 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 rah. It's not that you don't have enough gasoline. It's not that the oil's bad. It's that your internal parts are not working anymore. They're just all misfiring and need to be tuned up. And that's where I tell women we are going to help tune things up. We have the tools. You just need to come in and talk about it with us, and we will guide you in the right direction. Questions?
So you mentioned that women start losing between 20 and 40. When do people start coming in to talk to you?
So I've actually had 20-year-olds who come in, and most of the time I will tell women in their lower 20s, I'm like, we can certainly check hormones, because that is something that women should know and have a baseline on at any age. So I never tell them no. I do tell them that hormones fluctuate so much, especially when you're having menstrual cycles and such like that. But typically the testosterone is what they're really curious about, is where do I sit? And I tell them, we do drop that off in our 20s and 30s. Now, if you're on the higher end, there's not much I can help with that, but let's talk about the other symptoms. Is there another route we need to go? So yes, I've had 20-year-olds. The youngest woman I've pelleted so far is 29 years old, and no sex drive, doesn't want to touch her husband, has had a tubal ligation. That's another thing, is really we want you to have some type of birth control if we're going to use testosterone and you're still in the reproductive years. So that's an important one. And so, yeah.
Follow up.
Yes.
I have heard different things on this. Does tubal ligation impact your hormones in a way that might cause your entire face to break out and cause you to have to go pay $3,000 for fractal laser?
Oh my goodness. Wow. So here's the thing. Tubal ligations, I hear periods, commonly patients will call after the tubal ligations and they're like, things just feel off, And I tell them periods definitely can be off, especially if you're not in that perimenopausal or menopausal time frame. But typically acne, not so much.
Okay.
Not so much.
I'll stop blaming it.
Yes. Sorry
Probably
about that.
everything else.
Yes,
Oh my God.
yes. There's so many different things. Hormones can affect, and not so much just a tubal ligation.
When they say it's hormonal acne, it's okay. Well, what happened?
Yes.
All right.
Yes. Come see me.
I will forgive that guy.
Okay. Yes.
So I know I can tell I have hormonal issues and stuff, and I track on like a
App.
yeah.
Yes.
Those little strips and so I do that. But say I would need to be pelleted. Because you say a lot of people have like low sex drives before.
Yes.
What if it's already through the roof and I don't want it to go crazy? It's already crazy.
I'd be interested in what your testosterone levels are, first and foremost. But truly, I always have a conversation, because there's side effects with any type of medication or pellet that you use, and I always go over those in detail. But typically what I would say is, let's start with a lower dose and see how you do with that. Dose adjustments happen all of the time, and it can be symptoms. It can be, I just want to do a lower dose, and I'm happy with that. So it's very individualized. That's the beauty of it, right? Whereas if I prescribe you a patch, I'm kind of stuck with so many doses, So that's where I kind of say, this is the beauty of pellets. There's so many different doses, and we can dose adjust if we're having side effects or don't want to have more of a sex drive, those kind of things.
That might cause problems in my relationship. Is part of the reason why it's not a relationship anymore. So
Is because of
yeah,
the
because
mismatch?
Too high of a sex drive.
He needs the test.
Yes, he needs to come in.
He
Yes,
needs
yes,
the pellets in
yes,
his butt.
yes,
Probably more, but
yes,
My
totally.
husband doesn't.
Yes.
One of the things that I think I'm really thankful for is there's been so long that women just didn't talk about it.
Mm-hmm.
And, nobody told me, hey, you're going to have pain with sex. you're gonna have a low sex drive, you're gonna have all these things. And I was just like, I remember telling my friends, this is total bullshit.
Yeah.
I can't do this test. And, my husband's like, what the hell? So I will be coming to see you.
Yes, thank you. I think there's so much taboo and stigmatism with women like acknowledging their symptoms, and I think that's changed. I really do think that it's on the up and up, to be honest with you. And some of that I'm justified by these pharmacies running out of micronized progesterone recently. I'm like, yes, more people are using these things, right? But yeah, that vulnerable conversation to come in and talk to someone and tell them, oh my gosh, my life has turned upside down. I probably see 3 or 4 patients a day that tell me, am I nuts? Like, honestly, they want me to tell them they're not nuts, and I'm happy to tell them that most of the time. There's sometimes I'm like, we might need more intervention, more than I can provide here, but let me see what I can do. And also, I am not a bullshitter. I am very blunt. I will tell you what I think testosterone and estrogen can help with, and I'll also tell you what it won't, okay? Because if you're up here with these unrealistic expectations of me giving you these pellets or bioidentical hormone replacement, we're not going to be on the same page. And I like to be on the same page. I like to meet patients where they're at. I like to fix some of their goals, but I don't know if I'll fix all of them. And so I really have that deep conversation with a patient about that. Yeah.
So, I'm sorry for this question, but I'm a little bit further away. Do you recommend anybody around the Des Moines area?
Des Moines.
You're amazing, but
You can
Yes.
find BioT
Yeah.
providers by going to their website, the BioT website. You can find
There's a
providers.
template over there for
Yeah.
IoT. If you just scan the QR code on there, you'll be able to find providers in your area.
I do have patients that drive that far, though. And we would take you for a network, yes. Yes.
Yeah.
BioT
Quarterly,
is hard.
So it's not, like usually you're going quarterly, so it's
Yeah,
not terrible.
you're not.
You just have to see Christina more.
Yes, question.
Thank you, right?
Family history of estrogen positive breast cancer, can you not do any?
Yes, we can use HRT would be testosterone, and I would probably use something called testosterone with anastrozole in it. So we would make sure that estrogen does not increase when we're using it. It's a blocker of estrogen. Does that make sense? So we wouldn't use estrogen. I would not be comfortable with that, to be honest with you. But testosterone has so many benefits, and I tell women, I can probably get your hot flashes, your night sweats, your vaginal dryness. I'm telling you, these women come back in and are like, I am moisturized. And I'm like, I'm happy to hear that for you. I mean, I've heard it all. I've worked in the ER, guys. Like, honestly, I love that. I'm happy for them, truly. Just with testosterone to not have painful intercourse or vaginal dryness that's irritating, like, that's terrible to live with. So, yes, so there's ways around it, but it would most likely be testosterone through the pellets with anastrozole already included.
Can you do an IUD or should you
Yes, I love IUDs. Just first and foremost, there's many different types of IUDs. I think it's very specific. I don't know age and background and such like that. But yes, IUDs are a good thing, and most of the time because there's no estrogen in them. It's progesterone only. Your Marinas, your Kylenas, your Skylas. There's the non-hormonal copper IUD too. That's really kind of picking up some popularity and across the board too. What other questions? Yes.
Do you talk to patients about other things in their life that influence their hormones, specifically diet?
Absolutely.
Specifically diet.
Absolutely. I don't know if you gals were in here for the previous, but I do go to Amanda Campbell. I'm a tire trained lover for the past 5 years. So she's really instilled a lot
I
of...
can't get that girl to show up here again. She was here once.
Literally.
You guys can all put a little bug in her
I will
ear.
tell her. But I am very much so into nutrition, physical activity. I tell everyone with the shot, we do a lot of weight loss consults, and I'm like, hey, this is is not a miracle. This is not a miracle wand. This is not a miracle drug. You will lose weight, yes, but if you want to lose more weight and longevity and get off of these shots and not use these forever, I have to have you doing the outside things. And so I encourage water, fiber, protein, a huge conversation on that. And I'm like, I can tell if you're not doing the things. I need you to be doing the things. Vitamins, huge things. Supplements. I talk a lot about supplements. I don't love selling supplements, but I do see the benefit of vitamin D. I worked through the COVID period in internal medicine, and I'm telling you what, none of my people that were taking good amounts of vitamin D were sick. So I have a huge conversation about that. I also think it's really important just with your transition from perimenopause into menopause. When you lose that estrogen, guess what? Your bones take a huge hit with that. And so how we replace it is calcium and vitamin D. And there's no way in hell we'd ever get enough vitamin D through drinking milk or through sun, especially living in Iowa. So I have huge conversations about vitamin D and vitamin B12 too, also energy, fat metabolism, those kind of things. So just expect the whole gamut when you come in. We're going to talk about all of these things, and I try not to overwhelm. And I get to see women for an hour for your first appointments. Where do you hear that anymore? Like, where do you go that you can get an hour with a provider and get my individual attention? And then the lab review is about 45 minutes too.
So on the supplement question, I'm a huge supplement girl.
Sure.
However, supplements are very unregulated and poor measured for accuracy and quality.
Sure.
I know you're a doctor, but do you recommend a specific brand? And I know some of the ones that I've taken have been private labeled. You're paying a lot more for that.
Definitely. Yeah, so I'm a little biased because I think BioT, the supplements that we get through them, work really well because I can check the numbers, I can check the labs and make sure that the vitamin B is going up, the vitamin D is improving. Now, can people take it over the counter too and have results? Yes, but the fact that I can see the changes in the numbers always impresses me. Now, I also tell patients, because the pricing is high with these supplements, that you would never offend me if you chose something over the counter or if you chose something on Amazon. And most of the time they'll pull up something and they'll have me look at it, and I'm happy to look through that with you and give you my guidance. And as you know, it's not FDA regulated, so more of my professional opinion, but that's where I kind of leave that.
And are you saying that the pellets, it starts around $2,200?
Oh. Sorry, good question. So that's just the labs. If we were to send it through insurance, usually it's about $2,200. Your lab fee would probably be between $150 to $300, depending if it was sent through insurance. So usually women pay $50. How it works? Let me break this down. You call and schedule. You want to talk to someone about your hormones, okay, or perimenopause and menopause. They put you on my schedule. You come in. We have a very in-depth conversation. You have a female health assessment sheet, and I wish we would have brought these, because gosh, every symptom, and women are like, oh my gosh, I didn't even think about my joints, or I didn't think about migraines, I didn't think about headaches, my skin. And so I go through every single line, and I'm like, tell me about this. I want to know what's going on, okay? And then at the end I say, well, I think what we should do is start with a blood panel, okay? And that's that comprehensive blood panel. I tell them we can send this through insurance, certainly, but you're probably going to have a higher bill depending on your out-of-pocket. It's really hard. It's very. Yeah.
It's all patient specific.
Yes.
That's really
And then I say, if you would like to do it, it's $50 through our lab, and I can ensure that we won't send this through insurance. Okay, just the appointment itself, because they should pay for a hormone consult. And then what happens is you come back 1 to 2 weeks later. I send you with this book, and I'm like, please read just maybe a little bit of it, even, just so we can have conversation. And what did you learn, and what questions did you have? Okay, and then that's when we talk about pelleting. We talk about bioidentical hormone replacement, whether it's prescription or it's the pellets. Pellets are $350 every 3 to 4 months. Okay, so I tell women about $100 a month is what you would be paying for your pellets, and that doesn't matter if you're getting both testosterone and estradiol, or if you're just getting testosterone by itself. It's a flat fee. We don't have any surprise fees. We don't send you a monthly charge, anything along those lines. You can, yes. And
it's become the top of the priority list in our monthly bills. Like my husband's like, when you go to pellet,
yes.
good.
Yeah.
Bring his credit card all the time.
I love that HSA covers it. Flex spending is a no. That we do not do flex spending, just because if they were to audit, I don't think they would be privy about
Again,
that.
HSA can also be very tricky. If you have one that wants a very specified receipt, we will give you all the things that we can provide, but there's also some HSAs that come back and say, sorry, we're not covering it.
Yeah, but I feel like there's more coverage than not.
I would say probably 90% of people that use it don't have an issue with it. We've always got our 10% that unfortunately the HSAs don't.
And the other thing is I tell a lot of people, because I'll see them after they go to New Leaf or they go to a medical spa and such like that. And I went to the conference for BioT, and when I was there as a provider, you could tell the difference who was there to make money off of clients and who was there to help patients. And I think that's where we're really good at that, because at the end of the day, I want your symptoms to be better. I want to know, is everything good with the woman parts as well, and that's where if we had bleeding, I'd be like, I know what we need to do. And I want to make sure with this hormone replacement therapy that everything is fine. Oh, yeah. And then the other beautiful thing about this is BioT in our office. If in 6 weeks, because we always check labs 6 weeks after we do the initial pelleting, if you're not to the goal that we talked about, or your symptoms aren't significantly better, then we take all of that together, we put it in an algorithm, and we decide, does she need a boost? Because we told you we want you to get to this level, okay? So it's on us to be like, hey, you need to come in and get a boost. It doesn't cost anything to you at all. That's part of BioT and us, and we think that's the beautiful part. And I even do that down the road, even maybe 3 to 4 sessions in. If they're like, I just don't feel like what I used to feel like, then I'm like, come in for a lab draw, and if we need to, we'll boost you, and it costs nothing to you. So I do think that's the beauty of it, and making sure that patients are well managed. Any other questions? Thank you so much.